Doctor, there is a lot that is being talked about IVF. There are many celebrities, there are many known people who are talking about the entire thing. They are talking about their journey on internet.
See, IVF is not about advertisements or the success rates.
Is IVF also an option if there is infertility problem in men?
Yes, the problems for infertility is both partners.
Is IVF treatment these days recommended way too early than before?
A good fertility clinic usually is very, very transparent. It is important that any couple facing issues in getting pregnant have to be evaluated comprehensively.
What is your take on it?
IVF is one of the best innovations for mankind, but
IVF is something that we have been hearing about for a very long time. There are celebrities who are talking about it and opting for it. Is IVF just a buzzing word? Is it a hype? Is it a hope? Couples, when do they need it? When should they plan for it? Do they really need it? To talk about it, on our special episode today, we have Dr. Preethi Reddy, Lead Consultant Fertility, BirthRight Fertility by Rainbow Children's Hospital. Welcome, Doctor.
thank you.
So, Doctor, there is a lot that is being talked about IVF. There are many celebrities, there are many known people who are talking about the entire thing. They are talking about their journey on internet. What is your take on it?
Certainly, IVF is much talked about, and but I feel that this is a positive step because it has created a lot of awareness and it has reduced stigma. IVF is one of the best innovations for mankind, but it is not a trend or it is not a miracle solution for couples facing difficulties in getting pregnant. It is a scientifically proven treatment for all the couples who are going through the journey of fertility. So I think the key thing is about having realistic expectations on what the outcomes can be, because the outcomes a lot depend upon the age of the female partner or the underlying cause for which the IVF has been done or the overall health. Okay. So IVF, if done right, IVF is just not a hope, but it is an ethically based path for all the couples to build their families.
True, and many people who have been trying to conceive for a very long time, they feel that IVF is their last resort and they think that only IVF can solve their problems. So, is that hope right to have? Is that something that they should really feel about?
No, IVF is not always the last resort. I think every couple has a very unique journey and not one size fits everybody. So it is important to have a proper evaluation done, and because there are set indications where IVF is the only option. But before an IVF is considered, I think other options has to be, explored. In the sense, some couples may just need basic lifestyle changes wherein there can be some hormonal corrections and they can get pregnant. Or sometimes just if they have some ovulatory disorders, ovulation induction protocols can, very basic level of treatments can help them. Or sometimes even an IUI, or obviously, if all this fails, IVF is the only treatment. But there are certain situations where IVF can be the first step to get pregnant.
Right. And what are the common situations where you suggest IVF?
Yes, as I told you earlier, comprehensive fertility evaluation is a must. Okay, the treatment options come later only after the evaluation is done.
Right.
So once evaluated, and there are certain situations like, if there is severe male factor infertility, or there are blocked tubes, or if there is advanced age, if the woman is above 37, 38 and with a very poor ovarian reserve, egg reserve, or if she's young and she has very less number of eggs wherein her AMH is very less. Or sometimes it could be that other modalities of treatment has failed. So if she has undergone 3 or 4 IUIs and for unexplained infertility, or it could be PCOS, if those basic level of treatments have failed, then obviously IVF is the only option for her. And in cases of severe endometriosis also, IVF could be the first option to consider.
Right. And is IVF also an option if there is infertility problem in men as well?
Yes, the problems for infertility is both partners.
Right.
So wherein 50% of the issues are related to the female partner and 50% of the issues are with the male partner, which actually sometimes, it gets ignored.
Correct.
So whenever, you see couples coming, it's always the female partner who is the first one to approach the doctor to say, get herself evaluated. But we as fertility specialists definitely, ask both the couples to come, wherein there is a complete detailed evaluation done for both of them.
Right.
So, because we pick up quite a lot of problems, because the men seem to be very healthy, but surprisingly, sometimes we do see that the sperm count, or it could be the motility or the morphology can be a problem. So, in that cases, again, depends upon what is the severity of the problem.
Right.
So, it doesn't mean that any abnormal semen parameter would need a IVF, but it depends upon what is the severity. So, if you have very less counts, IVF is not straight advised. We have to, again take them through an evaluation, try to understand as to, what is the reason behind having less sperm count. So when a thorough evaluation is done, and first is they give some basic level of treatments in the sense of hormonal treatments and all. If all that doesn't, really help them, then IVF is looked at as a last option.
So, for our listeners today, Doctor, can you explain IVF in simpler terms? What is the journey? How can one get counseled? When would a couple know how the journey begins and how the journey looks like?
Good question, because I think it is very important for every couple embarking this journey of IVF need to understand, because so that they are mentally well prepared to start this journey.
Right.
IVF has actually changed a lot over the years. Now it has actually become very, very patient friendly. And usually, after a detailed evaluation is done, so whenever we start the IVF cycle, we start it from the second day of the period.
Right.
Wherein a few blood tests and the scans are done on the second day of the cycle, and for about 9 or 10 days, the hormonal injections are given, which is generally they can continue with their normal routine and come into the hospital for the injections and for scans.
Right.
So they can continue to do their regular work. So in about 9 to 10 days, the eggs reach the required size, the matured size, and then we give them the trigger shot and they come back to the hospital, and we give them anesthesia. We just put them to deep sleep.
Right.
For a brief period of 5-10 minutes. Hormonal injections are administered for 9 to 10 days, and within 9 to 10 days, the eggs usually reach the matured size. And once reached, we give the trigger injection for the final maturation of the eggs. And the patient comes back to the hospital, and we give them anesthesia. That is, we just put them to brief sleep for 5 to 10 minutes. And we do this procedure called as egg retrieval, which is done vaginally and with the ultrasound guided, and we retrieve the eggs. So I said it's a 5-minute process. Post that, she's expected to stay in the hospital for a couple of hours to, because she may be drowsy. And after that, she can go back home, take rest that day, and resume to normal activity from the next day. So once we have retrieved the eggs, and we take the husband's sperm and look at the maturity, quality of the eggs and the sperm. And usually we do a procedure called ICSI, wherein each egg is injected with a sperm.
Right.
And if any additional technologies are required based on the couple's indication, like microfluidics, or it could be MAC or oocyte activation, that is also done. And we leave the embryos in the lab, in the incubator, for about 3 to 5 days. If you're planning for a fresh embryo transfer, it happens in the same cycle. But if a frozen embryo transfer is planned, then these embryos get frozen. We freeze them,
Okay.
and the woman comes back in the next cycle. And for 2 weeks, we give them some tablets. We prepare the uterine lining.
Okay.
Once the uterine lining is ready, we transfer these embryos. So transferring the embryos is a very straightforward procedure, which is 5-minute process without anesthesia. The same thing, again, they're in the hospital for about 2 hours, go back home. The important part of this is after the transfer, we usually advise them to take rest at home for 2 weeks. It's not absolute bed rest. They can do their own work, but nothing very strenuous. So usually we advise them to take a week off from their work, and then some tablets and injections can be there, which can be taken at home. And after that 14 days, we come to know of the result. So it's a very straightforward procedure.
All right.
Because there are a lot of misconceptions around these treatments. Because I think usually patients ask me, doctor, is it complete bed rest required, or
Right.
is it very painful, or is it that once I get pregnant, do I have to for the initial 3 months, do I have to completely be taking bed rest, should be taking off from work? But absolutely, this is a very straightforward procedure. So for the initial few months, I mean, I would say for a couple of months, definitely there's a close monitoring of the pregnancy, but it is no different from a normal pregnancy.
Right. Like you mentioned, there are a lot of women who are a little scared to come for the treatments because they worry of the injections. They feel that these injections are very painful, and they have this misconception that this can be a damaging thing also for
Yes, yes.
So how would you want to,
See,
make them understand?
yes, this question I often get asked in the clinic, and these injections are only given for 9-10 days. These are hormones, but maybe the term hormones is something that scares.
Yes.
But these hormones do not have any long-term or short-term impacts on the body. They're given in the right dose that is calculated according to their need, in the sense their age factor, their BMI. So all that is calculated and the right dose is given. And these injections are not painful because most of the injections which go in are subcutaneous. So when I say subcutaneous, actually they can be administered by themselves.
Right.
These are like, the insulin injections which diabetics take. So it is as simple as that.
Right.
They don't involve like long needles and all of that.
Right.
And now actually we have needle-free injections as well.
Right.
So we've just started to, administer needle-free injections. So I think somebody who is actually fearing about phobia with needles, I think this is a very good option to consider.
Right. Are we administering needle-free injections
Yes,
in India?
yes. India, no, it's our clinic. I mean, our
Right.
BirthRight Fertility also, we have needle-free injections.
Okay. And how are they different from the?
It's the same. It's a device basically. Say when the very sight of needles and all usually scares more than the pain.
Right.
So this is just a device with pressure. The drug is getting administered subcutaneously.
Okay. And it serves the purpose exactly the same.
Absolutely. The potency, the efficiency of the hormone, all that is proven. And absolutely, it's just a pressure.
All right. Sure. So once you inject the hormones inside
Yeah.
women's body, so are there a lot of changes the women feels in the week or two?
Yes, I wouldn't say absolutely no changes, but I see few women have a little bit of, feeling lethargic, feeling tired, or feeling little bloated, or sometimes a bit of a headache. So these are very, very temporary, changes.
Right.
As I told you, they do not have any long-term impact.
Right.
So during that phase, yes, they may go through, but once the egg retrieval is all done, and within a day or two, they're back to their normal activity.
All right. And there is a myth also where people think that if they have gotten IVF done, they can expect 100% pregnancy.
Yes.
What do you say about that?
See, having said IVF is the most effective treatments, but it is not 100%.
Right.
The maximum success rates we see is about 50 to 60% in a given cycle. But when we look at the cumulative success rates, maybe, sometimes the couple can, require more than one cycle to get pregnant. Maybe, when we have surplus embryos frozen, so we do a second transfer. So usually the cumulative success rates go up to 70 to 75%. So it is a promising treatment. Having one failure does not mean that it is end of their road. It's not that, there are no means of getting pregnant.
Right.
So once there is a failure, I think it's important for, as a clinician, for us to, go through the entire cycle, assess the entire cycle, see, where the issue was and what is that we can do to improvise. Maybe it could be the protocol wise, or maybe it could be, with the hormones, or it could be the technology. So all that assessment has to be done.
Right.
And then a second cycle can always be pursued with.
And there are a lot of couples who come for an IVF, but after some time they conceive naturally as well.
Yeah, it's not very surprising to see that, because sometimes, it could be unexplained infertility. We don't know the reason why they don't get pregnant. So they have very good chance of getting pregnant in every cycle.
Right.
When they do not have any absolute cause of infertility, like blocked tubes, zero sperm count, other than that, they do have, good chances of getting pregnant spontaneously as well.
After the process of the entire IVF, and once a woman and the couple get through that, yes, we can go for an IVF, still there is a fear that if we conceive through IVF, the baby might not be as healthy as a normal baby would be. How would you explain that, and how would you take off that from people's mind?
See, we need to understand that IVF is a time-tested procedure. It's been more than 5 decades of IVF. And there has been a second generation and a third generation as well, children born with IVF. And absolutely, we don't see any increase in any congenital problems or health issues in the IVF babies born. So they have similar risks. Like if risk of babies born with problems is about 2 to 4%. Even with IVF, it's the same. What makes the difference is the age at which the woman is getting conceived. If a woman is getting pregnant with an IVF at 37-year-old, then obviously even if she had got pregnant spontaneously, she would have had the same issues.
Right.
Of having the child having a high risk of developing Downs and other genetic issues.
Right.
So IVF per se does not increase any health issues in the babies, and there is enough scientific backup
Right.
to prove this.
And a counseling would really help them understand.
Yes,
the
I mean, that is primary thing what we do. When they come in, we explain to them about the procedure. I think this is kind of, very strongly, fixed in their mindset that IVF has some, impact on the health of the child. But absolutely not.
In your entire career, doctor, you might have seen so many couples coming to you. Some might be okay with it. Some might be very scared of coming to an IVF center. So when a couple comes to you, there is a taboo in their head that if I go and tell other people outside that I am getting an IVF treatment, what would they think of us? So how do you deal with them? What is the first thing that you tell them? And how do you ask them to cooperate with each other or support each other in their day-to-day life?
See, what I've seen over the years is that the social stigma has definitely gone down. Now, discussing openly about IVF is something that, they're not hesitating. In fact, they're actually seeking support.
Right.
They want to, speak to women or couples who have undergone an IVF treatment, friends or family who have undergone. They're actually very open to speak about. So I understand that fertility journey is very, very challenging, and it definitely takes a psychological toll on each of them.
Right.
Best is to seek good support, either from the counselors, or we are always there to, talk to them. But supporting each other with patience is very important, because it is not an individual's journey. It is a shared burden for them. So they need to talk about it so that when that relationship strengthens between both of them, when they support each other, I think irrespective of the outcomes, they cope the treatments very well. What I have seen over the years is that IVF is no more a social stigma. I see that the couples are really open about it. They want to seek support. They're open to talk to other couples who have undergone IVF, or somebody in the friends or in family who can, they're open to discuss with them. So my advice to them is that they need to have realistic expectations on what the outcomes of IVF can be, because it's not an easy journey. It is a very, very challenging journey, and it is not an individual journey. Right. It is absolutely a shared burden. So whenever they're getting stressed or going through this emotional trauma, I think they need to speak out. They need to speak to their partners. Right. And both of them can take support from the counselors, or it could be from us fertility specialists. So they have to deal with each other. They have to support each other with a lot of patience, and understanding that, I think, can improve their mutual relationship, irrespective of what the outcomes can be. And that is how I think they can cope the fertility journey better.
What are the common questions that people usually come to you, or the fears that people usually come to you with?
The only fear I see with them is, will I get pregnant, doctor? Yeah, see, they're okay to go through this entire journey of, the injections, of this, uncertainty, all that keeps them going, is that kind of assurance.
Right.
Will the outcome be 100%?
Yes.
Unfortunately, no. But we actually counsel them in a balanced way, wherein, we're giving them realistic expectations of, how much the success rate can be, but at the same time, not to give up on this and have a hope.
Right.
Because at one point, even if it's not the first cycle, I'm sure, the second cycle or a different strategy can definitely help them to get pregnant.
Right. So, do you also get this question a lot that if I get an IVF, will I conceive twins or will I have multiple pregnancies?
With IVF treatments, yes, when we transfer a max of 2 embryos or day 5 embryos. So there is 15 to 20% chance of having twins. The reason why 2 embryos transferred is because to increase the probability of getting pregnant.
Right.
We do explain them when I'm transferring 2 embryos, there's definitely a chance of having twins. Not definitely, but 15 to 20%.
Right.
But if they're very clear that we do not want to take this chance, then we can only transfer 1 embryo
Right.
and freeze the rest.
Right.
If it's positive, well and good. But not, then we have this frozen embryos to transfer again. So that's absolutely a pure informed decision which can be made by the patient.
Right.
Not with IVF, but when with IUI treatments and ovulation induction, wherein we have no control
Right.
on how many eggs grow and how many are going to ovulate, there can be a chance of having twins.
Right. And also, these days we see a lot of advertisements around IVF centers, and there are very promotional messages on we can help you conceive and all of it. So, what is your take on that? How would one know that if clinic or the center they are visiting to is genuine and is going to really help them if the couple even needs IVF treatment or they can conceive naturally?
Yes. See, IVF is not about advertisements or the success rates. What one couple, when advised in IVF, need to look at a fertility center is basically whether they have a qualified fertility specialist, whether they have a qualified embryologist, and whether a center has the required infrastructure.
Right.
So once that is ticked off, I think the next is the couple has to ensure that they have been evaluated comprehensively and have been counseled about all the treatment options available and why is that they have been recommended an IVF treatment. A good fertility clinic usually is very, very transparent about the treatments, the success rates, and a very ethical based approach, and whether the clinic is providing them a comprehensive emotional support and counseling.
While talking about the entire journey and how the couples come to you with the changing lifestyles, there are a lot of couples in their late 20s also, which was not the case earlier, are coming for IVF treatments. Is IVF treatment these days recommended way too early than it used to be before? And if a couple is coming for infertility doctor, how would they ensure that the course of treatment that they have been advised is correct?
IVF treatment is definitely an effective treatment, but may not be the right step for everybody. I think it is important that any couple facing issues in getting pregnant have to be evaluated comprehensively. What all options are available has to be discussed transparently. Okay, they need to know as to why is IVF recommended over the other forms of treatments. Sometimes IVF can be the very first treatment, even if the wife is just about for 24, 25 years. In situations like that, IVF can be the first line of treatment because if she's had less ovarian reserve, if her egg numbers are very less. So, what couples have to understand is that IVF is not a quick fix. It is not to fast track pregnancy. Only when it is rightly indicated, it has to be done. Because we see a lot of them, actually want to program their planning of pregnancy. They say that, we are married, okay, now first 5 years, let's settle ourselves in careers and, job and everything, and then focus on planning pregnancy. By then, it could have been too late. Some issues with egg reserve or some sperm issues can actually come up with age. So then it actually becomes very difficult. Right. So when I see such couples, the minute they come to the clinic, they want an IVF because they think that it's a quick fix and they actually, even if other modality of treatments are advised, say if I've advised some lifestyle changes or if I advise them on IUI treatments, they're not willing to take it. They say that we have time constraints and we want to get pregnant within this year, so we just have a couple of months. We have couples asking for an IVF directly. So in there we actually counsel them that it is not a guarantee that even if I'm going to take them through an IVF, they're not going to get pregnant 100%. Right. So we try to tell them, explain them, looking at the condition, what is the right treatment for them, and then take them, through that journey.
Right. Doctor, you had mentioned that there are women in their early 20s, 24, 25, who have come for their IVF treatments. How different is it from a woman who's coming at the age of 24, 25 and a woman who's coming at the age of 36, 37? If a woman can get pregnant in their 20s or if late 30s, it is even more dicier. Does that change the probability?
See, absolutely. Women need to understand the fact that as they get older, the egg number and the egg quality diminishes. Age plays a major role in the success rates for an IVF. The younger they are, the better success rates. So the ideal, the peak of fertility for a woman is when they are below 30.
Right.
So once they cross the age of 30, we see that the egg numbers decline and the eggs are born when she was born. So obviously if she's 35, the eggs also are 35 years old. So with age, the quality also goes down. So, you see that increased risk of having miscarriages, difficulty in getting pregnancies, and also, having the genetic issues in the babies increases as the age increases.
Right.
So more so it is seen when they cross 37 years. Right. So definitely at a younger age, if they plan pregnancy or if they undergo treatments, the outcomes are definitely better compared to a woman who is above 35.
So I think, Doctor, you have covered a lot about how IVF can be hopeful to couples who want to get pregnant. And for the last question or for the last message, I would want to ask for somebody who is planning or who is worried about the pregnancy on this World IVF Day, what is your message to them?
My message to all the couples on this World IVF Day is that you're not alone in this journey. There are many couples who are facing this fertility challenge. And what you need to understand is that there are effective treatments for you to achieve this dream of parenthood. And IVF is one of the several options. And seeking fertility care early gives you a lot of options to get pregnant. Initial consultation has to be early so that your success chances are better.